Welcome to this ASN Clinic 360 podcast. I am Jonathan Chavez from the Hospital Civil de Guadalajara in Mexico, and today I will discussing our study published in Clinic 360, titled Outcomes of Initiating Peritoneal Dialysis versus Hemodialysis in Severe Symptomatic Kidney Failure. It was a prospective cohort that aimed to evaluate and determine the performance of PD compared to HD in the treatment of severe uremic syndrome in incident patients with end-stage kidney disease. We evaluate mortality during the first 3 months and the trajectory of solutes, volume, and other relevant outcomes in this context. We observed that the use of PD compared to HD offers similar outcomes in terms of mortality, correction of uremia, and technique survival. We found that the urgent start of PD is feasible and effective in the short and long-term outcomes compared to HD. Our results suggest that the reluctance to use PD as the initial modality in these urgent scenarios requires further consideration and ongoing evaluation. Our findings have important limitations typical of a cohort. It is a small single-center cohort, and the nature of its design only allows us to identification of associations. Additionally, data on dialysis adequacy and residual kidney function were missing, which were confounded by the short PD survival technique. The specific cause of the failure or loss of the technique was not determined. Our study provides the basis for considering a clinical trial comparing PD versus HD in the treatment of patients with symptomatic end-stage kidney disease who urgently require kidney replacement therapy due to severe uremic syndrome, where solute removal is the primary indication. Furthermore, it demonstrates that PD may be a viable option with similar efficiency to HD despite the severity of uremia. I have always considered that PD has been unfairly positioned as the kidney replacement therapy option that is not as effective and efficient as dialysis in the context of dialysis emergencies, both end-stage kidney disease and in acute kidney injury. From my perspective, the clinical evidence does not justify this. Studies like ours help us to better understand the performance of peritoneal dialysis and better adopt it. Thank you very much for joining us in the Kidney 360 podcast.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.